Have you ever wondered how intubation is done in different positions? That's the question we're exploring today. Intubation, a medical procedure used to create an open airway, is a critical component in healthcare. It's utilized in emergency situations, surgeries, and for patients who cannot breathe on their own. But did you know that the position of the patient can make a significant difference in the procedure? Yes, indeed. The way a patient is positioned during intubation can impact everything from the ease of the procedure to the patient's comfort level. This is where the art of intubation positions comes into play. Whether it's the sniper position, the toddler position, the kneeling position, or the reverse direct laryngoscopy position, each one serves a unique purpose suited to specific circumstances. Understanding these positions is an essential skill for healthcare professionals. So, stay tuned because in this video, 4 different intubation positions will be discussed in detail. First off, we dive into the sniper position. The sniper position is a unique and intriguing method for performing intubation. It's not your everyday go-to position, but it definitely has its merits, especially in certain tricky situations. Picture this. In the sniper position, the healthcare professional is positioned at the head of the patient, much like a sniper would be. The idea is to get a clear, straight shot, or in this case, a clear, straight view down the patient's airway. To perform intubation in the sniper position, the first step is to position the patient. The patient is laid flat on their back, with their neck slightly extended. Now the professional takes position at the head of the patient, sitting or standing based on their comfort. The laryngoscope is then inserted into the patient's mouth, with the blade sweeping the tongue to the left. This opens a clear path to the vocal cords. Next, the tube is introduced. It's important to remember here that the tube should be introduced from the right side of the patient's mouth, sliding it down the clear path you've created with the laryngoscope. With a steady hand and a clear view, the tube is inserted into the trachea. The sniper position offers several benefits. Firstly, it provides a clear, direct view of the patient's airway, which can make intubation easier and quicker. Secondly, it allows for a more controlled and precise movement during the procedure, reducing the risk of injury. However, there are a few challenges associated with the sniper position as well. It requires a certain level of skill and experience to perform successfully. The professional must be able to maintain a steady hand and a focused eye throughout the procedure. In addition, the sniper position may not be suitable for all patients. For instance, it might not work as well for patients with neck injuries or certain types of airway obstructions. In summary, the sniper position is a unique and effective method for performing intubation. It's not a one-size-fits-all solution, but it's a valuable tool to have in your arsenal for those specific scenarios that require a direct, clear view of the airway. That is the sniper position in a nutshell, a position best suited for specific scenarios. Next on the list is the toddler position. This is a method that is aptly named because it mimics the posture of a small child sitting upright. Now, let's delve into the intricacies of how this position is used for intubation. So, how does the toddler position work? Imagine a toddler sitting upright, their head slightly extended. This is the position you're aiming for with your patient. The patient is seated upright with their head slightly extended, and the intubator stands behind the patient. The intubator then reaches around the patient's head to access the mouth and airway. Now let's talk about the procedure in the toddler position. The first step is to position the patient. As we've mentioned, the patient needs to be upright with their head slightly extended. The intubator then stands behind the patient, reaching around to access the airway. A laryngoscope is typically used to visualize the vocal cords and guide the tube into the trachea. There are several advantages to the toddler position. The first is that it can be more comfortable for the patient, especially those experiencing respiratory distress. Being upright can make it easier for them to breathe. It also provides a clear view of the vocal cords, making the intubation process smoother. However, there are potential difficulties to be mindful of. One of the challenges is that it requires a certain degree of physical strength and dexterity. The intubator must be able to maintain the position while manipulating the equipment. Additionally, it may be more difficult to control the patient's movements in this position, especially if they are restless or combative. Despite these challenges, the toddler position can be a crucial tool in your intubation skill set. It can be particularly useful in emergency situations where a patient needs to be intubated quickly and there's no time to move them to a more traditional position. In the end, it's about choosing the right technique for the situation and the patient. The toddler position, while challenging, can be vital in certain situations. Remember, practice makes perfect, and with time you'll become adept at navigating these different positions. Now, let's explore the kneeling position. The kneeling position, as the name suggests, involves the healthcare professional assuming a kneeling posture while performing the intubation. This position is exceptionally valuable in situations where the patient is on the ground and there's limited space or no available equipment to elevate them. Let's take a walk through the process. First, you position yourself on your knees at the patient's head, ensuring you have a clear view of their airway. Your knees should be roughly hip-width apart, creating a stable base. Then you carefully position the patient to align the oral, pharyngeal and laryngeal axes, which aids in visualizing the vocal cords. Once the patient's head is correctly positioned, you can proceed with the laryngoscope insertion and intubation. The kneeling position boasts several benefits. One of its most significant advantages is flexibility. You're able to maneuver easily in limited spaces, and it's adaptable to various scenarios, whether in a cramped ambulance or a crowded event. It also allows for quick transition, saving valuable time when every second counts. However, like all techniques, the kneeling position does present its own set of challenges. The primary issue is that it can be physically demanding, particularly on the knees and back, especially when used for extended periods. Additionally, the viewing angle can be more challenging compared to other positions due to the lower perspective. Therefore, it's always crucial to practice this position to become comfortable and efficient with it. Despite these challenges, the kneeling position remains a useful tool in the intubation toolkit. Its flexibility and adaptability make it a go-to option in many emergency scenarios, particularly when dealing with patients on the ground. In conclusion, the kneeling position is not just about being on your knees, it's about adaptability, flexibility, and the ability to provide critical care in challenging environments. Remember, the key to successful intubation in any position is practice, practice, and more practice. The kneeling position, a flexible and adaptable approach to intubation. Finally, we delve into the reverse direct laryngoscopy position. This position is a fascinating deviation from the norm, offering a different perspective on intubation. While it might sound complicated, it's just a clever rearrangement of the traditional laryngoscopy position. So, what exactly is the reverse direct laryngoscopy position? Essentially, instead of the conventional face-to-face approach, the intubator is positioned at the head of the patient, facing their feet. The laryngoscope is held in the right hand and the tube is inserted with the left. This position can be particularly useful in situations where access to the patient's head is limited, or the conventional positioning is challenging due to the patient's anatomy or the presence of injuries. Now let's get into the details of intubating in this position. The first step is positioning yourself at the head of the patient, ensuring you have a clear view of their airway. The laryngoscope is then inserted into the mouth in a reverse manner, with the blade going in first. The goal is to visualize the vocal cords, which may require a slight adjustment of the angle of your laryngoscope. Once the cords are in view, the endotracheal tube is inserted with your left hand, guided by your view of the cords. As with any technique, the reverse direct laryngoscopy position has its advantages and potential difficulties. On the plus side, it can provide excellent visibility of the vocal cords, especially in patients with difficult airways. The position also allows for more control over the endotracheal tube during insertion. However, this comes with a learning curve and can feel a bit awkward at first, especially for those accustomed to the traditional approach. In spite of these potential difficulties, with practice and patience, proficiency in the reverse direct laryngoscopy position can be achieved. It's a valuable skill to have in your intubation toolkit, expanding your options in challenging situations. The reverse direct laryngoscopy position, a unique and specialized approach to intubation. It's not just about doing things differently, it's about having the versatility to adapt to any situation and provide the best possible care to your patients. Each intubation position has its own unique set of advantages and challenges. Over the course of this discussion, we've examined 4 of these positions: the sniper, the toddler, kneeling, and reverse direct laryngoscopy. In the sniper position, we saw how lying prone can provide an optimal line of sight. The toddler position, on the other hand, illustrated how assuming a lower stature can help when dealing with small patients. The kneeling position demonstrated how this stance allows for quick adjustments in emergency situations. And lastly, the reverse direct laryngoscopy position showed us that sometimes, conventional methods must be flipped on their head for the best outcome. Each of these positions represents a tool in the healthcare professional's toolkit, and knowing when to utilize each one is a testament to their skill and adaptability. Understanding these positions is crucial for healthcare professionals, ensuring the right approach is taken in every situation. Thank you for tuning in.